Discover the different types of depression. Delve into the intricate web of depression and its myriad types, uncovering the mechanisms and characteristics of each. Depression is often portrayed as a lingering sense of profound sadness. Yet, much like a prism refracts white light into a rainbow of colors, depression also manifests in distinct forms. While they share core features, there are different types of depression, each with specific symptoms, duration, and severity. In this article, we will unravel the various types of depression and their specific symptoms. With this broader understanding, you will be better equipped to recognize warning signs, both within yourself and others, and seek the necessary support to navigate this challenging condition. Major depression, the most common type. Major depression, also known as major depressive disorder, is widely recognized as the most prevalent type of this mental health condition. It is characterized by the presence of persistent and severe symptoms that significantly impact the daily life of the affected individual. Familiarize yourself with some common symptoms of major depression. Deep and persistent sadness. An intense and enduring feeling of sadness, typically present for at least 2 consecutive weeks. Loss of interest or pleasure. Diminished or absent interest in activities that were previously sources of pleasure and satisfaction. Sleep disturbances. Difficulty sleeping, insomnia, or excessive sleepiness, hypersomnia. Appetite changes. Significant weight loss or marked weight gain, often associated with changes in appetite. Psychomotor agitation or retardation. Physical manifestations of restlessness or alternatively, slowed movements and a sense of sluggishness. Fatigue and loss of energy. Constant feelings of tiredness and lack of energy, even after adequate rest periods. Feelings of guilt and low self-esteem. A persistent sense of guilt, worthlessness, and impaired self-esteem. Difficulty concentrating and making decisions. Difficulty focusing, making simple decisions, and maintaining concentration on tasks. Recurrent thoughts of death or suicide. Persistent thoughts related to death, self-destruction, or suicide, sometimes accompanied by specific plans. It is noteworthy that not all individuals experience all of these symptoms, and their severity may range from moderate to severe. The precise diagnosis of major depression is made by a mental health professional after a careful and comprehensive evaluation of the patient's clinical picture. Persistent depressive disorder, dysthymia, a constant shadow. Imagine living with a chronic sadness, like a gray cloud that accompanies you for years. Such is the case with persistent depressive disorder, also known as dysthymia. While the symptoms are less intense than in major depression, they persist for a minimum period of 2 years, affecting the person's quality of life. Symptoms of dysthymia include persistent depressed mood, a constant feeling of sadness, present for most of the day and nearly every day, loss or decrease of pleasure, reduction or absence of interest in activities that were once sources of pleasure and satisfaction, fatigue or lack of energy, a constant sense of tiredness and lack of vitality, low self-esteem and self-confidence, a chronic feeling of personal devaluation and lack of confidence in oneself, difficulty concentrating and making decisions, difficulty maintaining focus and making decisions even on simple daily matters, sleep problems, changes in sleep patterns including insomnia, difficulty sleeping, or hypersomnia, excessive sleep, appetite changes, changes in appetite that may result in significant weight loss or gain, feelings of hopelessness, a persistent feeling of hopelessness regarding the future and one's own life. If you identify with some of these symptoms for at least 2 years, it is important to seek professional help for diagnosis and the development of an appropriate treatment plan. Bipolar disorder, from the peak of euphoria to the valley of depression. Bipolar disorder, once known as manic depressive psychosis, is a complex mental health condition characterized by alternating mood episodes. In contrast to unipolar depression, bipolar disorder involves periods of mania or hypomania, marked by elevated mood, grandiose thoughts, increased energy and activity, as well as impulsive behaviors. Familiarize yourself with the types of bipolar disorder. Bipolar I disorder. Characterized by the presence of at least one episode of mania, often accompanied by severe depressive episodes. Bipolar II disorder. Involves episodes of hypomania, less intense manias, and severe depressive episodes. Cyclothymic disorder. Features rapid cycles of mood changes that do not reach the intensity of full mania or major depression. Bipolar disorder requires specific treatment, as episodes of mania and depression can have a devastating impact on the affected individual's life. Seasonal affective disorder, winter depression. Have you ever found yourself facing a persistent sense of lethargy, lack of energy, and despondency as winter approaches? For some individuals, these mood changes, seemingly following a seasonal pattern, may indicate a clinical condition known as seasonal affective disorder. Familiarize yourself with some symptoms of seasonal affective disorder. Depressed mood and lack of interest. Persistent feelings of sadness and disinterest in activities that normally bring pleasure, especially during the autumn and winter months. Sleep changes. Increased daytime sleepiness and difficulty waking up in the morning are common. Appetite changes. Increased craving for carbohydrate-rich foods and associated weight gain. Lethargy and lack of energy. A constant feeling of tiredness and lack of vitality. Difficulty concentrating and making decisions. Trouble focusing on tasks and making decisions, even in simple situations. Irritability and restlessness. Frequent feelings of irritability and restlessness. Social withdrawal. Tendency to withdraw from social interactions and prefer isolation. If you notice these symptoms recurring during the autumn and winter months, and they diminish or disappear in spring and summer, it is important to seek medical or mental health professional help for a careful evaluation and possible diagnosis of seasonal affective disorder. Peripartum depressive disorder, the postpartum sadness that lingers. The arrival of a baby should be a moment of pure joy and fulfillment. However, for some women, the period after childbirth can be marked by profound sadness, intense anxiety, and an exhaustion that seems never-ending. This cluster of symptoms constitutes peripartum depressive disorder. Symptoms of peripartum depressive disorder include persistent depressed mood, a constant and intense feeling of sadness that persists after childbirth, severe anxiety and panic attacks, excessive worries and episodes of intense anxiety, loss of interest in caring for the baby, difficulty emotionally connecting with the baby and performing tasks related to infant care, feelings of guilt, inadequacy, and worthlessness, negative beliefs about one's own capacity as a mother, accompanied by feelings of guilt and worthlessness, difficulty concentrating and making decisions, trouble maintaining focus and making decisions, even in simple daily matters. Sleep disturbances. Sleep disorders, including insomnia, difficulty sleeping, or hypersomnia, excessive sleep. Appetite changes. Changes in appetite that may result in significant weight loss or gain. Recurrent thoughts of harming oneself or the baby. Intrusive thoughts and concerns about causing harm to oneself or the baby. It is of utmost importance that a woman with suspected peripartum depressive disorder seeks professional help as soon as possible. Early treatment is essential for the well-being of the new mother and her baby. Other forms of depression. Not all sadness fits into a box. In addition to the types mentioned earlier, there are other forms of depression that require special attention. Premenstrual depressive disorder, PMDD. It presents depressive symptoms that arise in the luteal phase of the menstrual cycle, that is, in the period between ovulation and menstruation. Post-traumatic depression. Triggered by traumatic events, such as experiences of violence, severe accidents, or significant losses. Psychotic depression. Accompanied by psychotic symptoms, such as delusions and hallucinations, occurring in conjunction with depressive symptoms. As we observe, depression is not limited to a single form, but rather presents itself as a spectrum with diverse manifestations. By understanding the different types of depression, their symptoms and peculiarities, you will be better equipped to identify it in yourself or someone close to you. If you suspect you are experiencing any type of depression, do not hesitate to seek professional help. An accurate diagnosis is essential to guide the most appropriate treatment. Remember, depression is treatable. Seeking professional help is the first step to reclaiming quality of life and rediscovering emotional well-being. Frequently asked questions. Question 1. Which type of depression is most severe? The severity of depression varies according to the type and intensity of symptoms. Disorders such as major depression and bipolar disorder can be quite debilitating, requiring intensive treatment. Question 2. Can I have more than one type of depression? Yes, it is possible to be diagnosed with different types of depression simultaneously. For example, someone with bipolar disorder may also experience episodes of seasonal affective disorder during the winter. Question 3. Is there treatment for all types of depression? Yes, depression is a treatable condition. Treatment may include therapy, medication, or a combination of both. The type of treatment is determined by the mental health professional based on the diagnosis and severity of the condition. Question 4. How can I help someone with depression? Offer emotional support, attentive and non-judgmental listening. Encourage the person to seek professional help and accompany them to medical appointments. Show care, understanding, and patience. Question 5. Is depression curable? Although depression does not have a definitive cure, it is a manageable chronic condition. With proper treatment, a person can achieve emotional well-being and a fulfilling life. We have reached the end of the audio. Discover the different types of depression. Did you like this content? Share with someone who needs support right now.